How are individuals accessing mental health care during lockdown periods? What are the challenges you have faced as your clients transition to digital platforms? Are there foreseeable opportunities? Could you tell us a little bit about that experience?
Let's discuss the opportunities for online services at different levels, at the individual person-to-person psychiatric service or psychological service, or at the level of an institution, which could be a medical institution, or at the level of the province or nationally. One of the huge challenge for us in developing countries is that mental health services are inaccessible, and at least 75 to 80% of the population of the people who suffer from mental disorders do not have access, thus comprising a huge treatment gap. So the online services are, I think, very promising in the way that if people are living in far-fetched area, or if there is a dearth of specialists in a particular city, then it's easy to access a specialist in another place. But of course, this would be resource dependent, and we would need not just access to a computer, but a good internet connection also, which is not very common if you look beyond the urban centers or beyond a certain social strata, socioeconomic strata. What I found was extremely helpful is that when after the pandemic and in the first 2 weeks, of course, nobody could understand how to suddenly offer alternative services online. I too was taking time, but what I noticed that even in that period when I was not sure, I could still provide emergency care to patients or give them brief emergency interventions because I could connect with them online. So for emergency care, I definitely found that this was very helpful. One of the experiences that I had as a practitioner was that I found that not many people have the privacy in their homes to have a psychiatric consultation. So especially those where I was working with long-term complex childhood trauma, I found that they were very uncomfortable sitting and talking in a room where they could be overheard in another room. And more than a couple of times, I think thrice or 3-4 times, what has happened is that patients chose to go and sit in their car to have a session with me. So also I've had some experiences where a young man who had some paranoid ideation, he was constantly looking around the screen and looking at buttons. And finally, he asked me whether I was recording the session or not. Also, I find that engaging children on the screen is very difficult. The work that I do with the families, where you have many members of the family come together, it becomes very difficult to see all of them together on a camera. Sometimes they're sitting together, squeezing on a settee, and then, of course, they are so uncomfortable, it becomes difficult to see the dynamics. So I particularly don't think that it's online service is good for family work. Learning disability, very difficult. Not everybody is technologically savvy. I had some difficulty understanding where to look. I still don't know if I look at the right place on the screen or not. So another problem that I found was that although in my everyday person-to-person clinical work, I was doing regular 4 to 5 hours of clinic every day, but here on working online was very exhaustive. And after a couple of hours, I feel that the screen, this has been described as Zoom fatigue. So whether it's Zoom fatigue or it's that we are not feeling revived because of the human connection, which is so important in a psychotherapeutic setting. So that's been my kind of individual experience as a practitioner. But going on to what we are doing for the pilot project that we are working to implement, I think that digital technology has offered us tremendous opportunity, because in the pandemic, when it was not safe to meet people face to face, so this is an alternative way of reaching out. One, it's extremely helpful to train large cohorts who might be geographically spread out, and there's a lot of travel cost. There's a lot of training cost goes into the travel expense and bringing people together in a room. Also, I find that some of the trainings that we are discussing, we are now very easily thinking of involving specialists who are not living in the city, which was not very feasible before. Even we've been thinking of engaging specialists or experts who are living in other countries. So this has become possible. So I think that there is a huge opportunity for us to design interventions in low resource settings where there's a dearth of specialists, where there's dearth of trainers, specialists, and large populations to be served.